And in other ways, it seems like it's gone remarkably fast, and we've done a lot of things within a short amount of time. So let's just think about these numbers, though. In just that one short year, this virus has infected over 24 million Americans. Over 400,000 Americans have died from COVID. This is more than the number of Americans that were killed in World War II, which lasted many years. SARS-CoV-2, the virus, and COVID-19, the illness, are things we knew almost nothing about a year ago. And it's now one of the leading causes of death in our country. The enormity of the loss we have experienced this year is impossible to express, especially for those who have lost loved ones and for healthcare workers who have cared for COVID patients and witnessed these deaths. At this time last year, scientists and doctors were raising alarm about the potential for a pandemic. And some of the brightest scientific minds around the world joined forces to study and to fight this new virus. And thanks to those efforts, we now have safe and highly effective vaccines that will help us bring an end to this war on COVID. But of course, we're not there yet. But these kinds of milestones are an opportunity to look back on what we have already made it through, what has gotten us this far through this war, and that gives us hope that we can make it through these final battles together. Now, the first data that we want to report out today is about our vaccine distribution, and this will become more and more clear farther along we go. So to date, the task force hospitals have given over 99,000 doses of COVID-19 vaccinations to healthcare workers. So it's very important to discriminate doses versus people. So close to 100,000 doses of vaccine have been distributed to frontline healthcare workers across the metropolitan area. And that includes first and second doses. So a certain percentage have completed their series. Some still are requiring that second dose. This amount also doesn't include other healthcare workers that have been immunized, including people out in the community that do healthcare, emergency medical services, all of those other people that fit within that 1A category. So it's a significant amount of doses that have been delivered. Now, in addition, the state has also been immunizing those patients that live in nursing homes, or really it's those residents that live in nursing homes and long-term care facilities, as well as their staff. And from what we've come to understand, they should be finishing that work very soon. Now, we're just really starting with vaccine distribution outside of healthcare workers. But those doses are going to save lives, and these are reasons to celebrate. So now let's take a look at some of our daily numbers. Oh, and as I forgot to mention, I apologize. We did some averaging across all of the healthcare systems, and it's around 63% of all the employees in healthcare have received their initial dose. So let's look at our hospitalization numbers now. So we've continued to see a gradual decline in our admission numbers, which is good. Today we're reporting 68 admissions to task force hospitals, and again that's over a 48-hour delay. And that brings our 7-day moving average down to 85, which is good. Still a high number of admissions, but it is gradually decreasing, which we hope will continue. Looking at our census numbers now, today we're reporting 613 hospitalizations of confirmed COVID positive patients. And again, that continues to be a gradual decline from that peak that we saw back in late November, early December. And the moving average now is at 662 patients. So again, good news to report. A little bit more in depth into those COVID positive patients. As I said, we have 613 patients admitted to our hospitals, We have 120 patients in our intensive care units, and we have 82 confirmed COVID patients on ventilators right now. Now let's take a look at our suspected COVID patients. So we have 42 people hospitalized today with suspected COVID. We have 9 suspected COVID patients in our intensive care units, and we have 6 suspected COVID patients today on ventilators. Going on to our good news slide, we've discharged 113 patients yesterday with COVID. Well, say have recovered from COVID. And that brings our cumulative total to close to 17,000 patients that have been taken care of in our task force hospitals and discharged home. And again, a shout out to our healthcare workers and everybody that supports them, getting all of these patients well enough to go home. Unfortunately, we still are experiencing people dying from COVID as well. Today we're reporting 12 COVID deaths from the inpatients in our task force hospitals from yesterday, and that brings our 7-day moving average to 14 deaths per day. And again, the slide that we always share, which helps us relate those deaths to the hospitalizations back to the admissions, which ultimately comes to those cases which are spread out in the community. We cannot forget that the way to continue to bring all of these numbers down until we can get much more vaccine out the door is to continue to practice all of those protective measures. Continue to wear a mask, continue to do the social distancing, continue to not gather in crowds. We're on the right path. We just have to make sure that we're staying with all of those things that have gotten us here. We are, of course, very glad to see the number of hospitalizations and the deaths declining, and we're hoping and praying that this will continue. The important thing to remember is that while these numbers are declining, they're declining from a very high peak, and so we still have a way to go. The virus is still spreading, and in the grand scheme of things, we've really just begun to distribute vaccine to people who need them. Now, we all need to continue those preventative actions that I just spoke about and that we've practiced over the last year to protect ourselves and the people around us. And with that, we'll go ahead and take some questions from the media.
How difficult is distribution of doses and the planning of mass vaccination given the federal government's irregular shipment of the COVID vaccine?
Yeah, that is one of the challenges with trying to schedule vaccination clinics. So if you think about this, I'll just use an analogy. If you were going to run a factory and you wanted to produce so much of something, I used that example of bicycles earlier this week. And so let's say you wanted to produce a certain number of bicycles, but you didn't know how many wheels you were going to get on any given day. So that makes it really hard to organize your manufacturing line if you don't know how much raw product or how much of your parts are going to come in on any given day. So do you schedule 100 workers to come in, or do you only schedule 10? And then the other side of that is you need patients, so you need other things to sort of complete the process. So how would you know how many of those bike frames to bring to the factory floor to get the wheels put on them if you don't know how many wheels you have? And so that's what makes it somewhat challenging for us to figure out how much can we vaccinate on any given week, and then how can we schedule people to come in and get vaccinated on any given week. Some weeks we get a significant amount of vaccine, and in other weeks we don't receive any. So one of the things that we really need is a consistent delivery of vaccine. And I know it's challenging trying to load balance where vaccine gets sent to, but that is one of the things that we really need to work on so that we can be much more efficient in how we schedule people and then how we get them vaccinated, and then we can move on to those other populations.
Vaccine distribution remains an issue across our area. Do you feel like there's been progress this week. The first of those mass vaccination sites with the National Guard is opening today in the Poplar Bluff area. Do you believe the National Guard's help will help speed this up?
Well, yeah. So, if you think about it in total, anything that you can do to increase the rate of vaccinations is going to be helpful. And so if that is having the National Guard set up a mass vaccination site, then that adds to your capacity to vaccinate more of the population. So remember, it is the rate of vaccination that gets us closer to herd immunity. We already have enough people that need vaccination. What we need is vaccine and then the capability to deliver vaccine. So that's the rate. If we can do that faster, then we get to herd immunity faster, and then we get to reopen the economy and do all of those other things, get life back to normal faster. So anything that contributes to vaccination is a good thing.
There are reports the state of Missouri is leaving out rapid test results from the case counts. Do you believe this is painting an inaccurate picture in the state?
Well, it's certainly not as precise as you would like it to be. Now, whether I really don't know the numbers, so I don't know how far it would sway the data one way or the other, or what percentage of tests those rapid tests are. And then you always have to remember that they're not as sensitive and specific as the PCR-based test. So as when you're looking at the data for testing, you're looking for trends. And so there's enough sort of saturation of those PCR-based tests that it's a good sample of what is occurring out in the community. So as a whole number of cases, yes, it's undercounting the whole number of cases. But using it as a metric to see what direction are we going as a population, it's probably less material for that. And we do know that the percent positives for the PCR-based tests are coming down. And so we feel confident that that is a reflection of what is going on out in the community.
UK leaders warn the so-called UK variant may actually be more dangerous in addition to being more contagious. Is this something we are testing for, and how would this affect the hospital system?
Yeah, I read about that as well. So the way that it would impact the healthcare systems and how are we testing for it. So there's not a specific PCR-based test to look for the UK variant right now. However, the tests that we are using would pick it up. It just wouldn't distinguish it from the more common coronavirus that's circulating right now. Now, there are ways that the state lab can look for the UK variant, and it's based on some of the genomic sequences that are different with the UK version versus the more common version. And then there's also the state sends a certain number of samples down to the CDC as sort of a surveillance program now. From what I understand, it's a pretty small amount, like 25, which may or may not be an adequate sample size to detect for doing good surveillance. But be that as it may, there is some surveillance out there. Now, as far as the increased severity of disease, so if you coupled increased ability to transmit as well as increased severity, that of course would have an impact on the healthcare systems, because then you would have more patients coming to the hospital and they would be more sick than you would see with the more common variant that's circulating around. And that of course could put a large strain on the healthcare systems if this were to become rapidly disseminated in the population, which is all the more reason why we have to remain very diligent about all of those mitigation strategies, such as masking, social distancing, not gathering in crowds. Because if it's more transmissible, then you have less opportunity to sort of mess up. If you're not wearing a mask, then you could be infected. So it makes it's even more important now to do those things if the UK variant is around.
That concludes our list of questions received prior to today's briefing. Thanks for watching.